Why are medical tests and medicines more expensive inside hospitals than outside? This is very, very, very different. You have asked a very good question. It is very important. How will hospitals survive? Every hospital has some profit centers. 1,400 people work in our hospital. Out of these 1,400 people, there are 180 consultants, 250 postgraduate doctors, and so on. Okay? We run the hospital with the profits that the hospital earns from these profit centers. Okay. So the MRP price of medication, where we get the MRP price from the pharmacy, is a government rule that you cannot sell more than the MRP price. Prime Minister Modi introduced that 4 years ago. So we have to declare what is the MRP price of every drug. Okay. So you cannot sell more than the MRP price. So when we buy from a pharmaceutical company, and the vendor, middleman, distributor, whoever the distributor is, will give us 10, 20, 25% less than the MRP price. Okay? Okay? This is according to the policies and rules of the government. Right? So, the remaining 10 to 15% is for us to run the hospital, to pay salaries, or for hospital management. If we sell at cost price, okay, leave the hospital business. What kind of business will it run? No, this is fair. Outsiders must be doing the same. Yes, you add your 15 to 20% and sell it further. Absolutely. Look, there are good pharmacists. India has a big problem. There aren't 50 to 60 pharmaceutical companies here. We only have thousands, so. This is acid medication. Understand, we call it PPI. Everyone knows about heartburn, the burning sensation we get with Omez tablets. You know, these tablets are manufactured by at least 100 pharmaceutical companies. So, which standard company should we buy from? How should I believe you know? A company you've never heard of will come and send you a tablet for 20 paise. Other big companies, the top 20, will cost 1 rupee. So how do we decide? So, what happens in good hospitals? In hospitals like ours, we buy from top pharmaceutical companies, those with reliability. So, I'll tell you about the diagnostic tests. This is another problem. In India, there could be a diagnostic center on every street. Because licensing is so easy, there's no overestimation of quality. Yes, absolutely no overestimation of quality, okay? I've seen it many times. Many times every month, 3, 4, 5, I see patients in the first half of the day. Okay. When I see their reports, this test result cannot be like this. So when we get it done in our hospital, the result is completely different. You can imagine that someone's blood count is anemia. Their blood count report comes to us saying that I have this 6 grams. When the hemoglobin count should be 12 to 13 normal and it is 14, oh, how can it be? This person is absolutely fine. No one is talking about any weakness. When I examine him, nothing like this is visible in his eyes. So when I have doubts, when we repeat it again, his hemoglobin came out to be 11. So the problem is that by getting it done at such a cheap price from an outside company, I hear that it is correct. They do not use quality control. Every morning, every test has to be verified and standardized using a quality control test kit to generate a report, and that's a cost. We often don't use these small private labs. That's why they charge a lower rate. There's no standardization. When I see patients, I tell all the doctors in the hospital that they should do it at Continental. You might be paying 10 to 20% more. But we have reliability. We go and see our doctors, pathologists, biochemists, and microbiologists, right? They're all in the same building as the hospital. There's standardization. We have accreditations, NABH, NABL, and the Joint Commission. You know, how did they get our accreditations? It's because we maintain standards. We don't allow mistakes. Right? That's very important. The standardized big chains outside are fine, so there will be a 510% difference between one hospital and another. See, their overhead maintenance is less. In a large hospital with 600 beds, when 400 to 500 nurses are working there, okay? So the cost will be a little higher. And there are more machines. There may be sophisticated equipment. There is volume there. These chains, now all chains, I don't rate them. Okay, you know, many mistakes can happen in all chains too. But due to volume, they can charge a lower rate. Okay, when you have a volume, I think there is no 5.2x minus 3x difference. There is no difference. 2x minus 3x difference usually does not happen if you are doing it with the standards. But when there is an inpatient in the hospital, this also has to be understood. Outpatient rates are always different from inpatient rates. What is an inpatient? When a patient is admitted to the hospital, okay, we treat them as inpatients, and those who come in from outside, or get tested, you know. So, what we see in clinics is that thousands of people get tested every day, whether they go to the pharmacy or not, their rates are lower or different. So, inpatient rates are linked to insurance. Those rates are usually a little higher because of the hospital cost. We have to look after the patient, there's nursing care, their diet, everything. So, you know, the inpatient rates anywhere in the world are much higher than outpatient rates. Okay, if you have any questions about that, please ask. Clarify with them. And you can ask. But what happens? Look, if people see a bill like that, they have to pay out of pocket. How? Those people want us to make the patient well from one side. Okay, discharge him properly, but they suffer after paying the bill. Whatever good we do for them, that impression gets completely erased. That is why, what we do in good hospitals, we come every 2 days and tell the patients, because it is their responsibility. Okay, don't do this to us, or else transfer us to some public hospital. Okay, you should tell me what expenses you are incurring by staying here. You should come on the final day and say that you have to pay me 20 lakhs, all of a sudden. No, we should not do that.
Thank you so much for watching this clip till the end. If you want to see more such clips, then subscribe to Rajman Clips channel.